and if I lose power, I'll have to
Just
go
check.
outside into my car to hook up to charge my phone back up. So if I
If you're
lose power on my phone, because that's the only thing that's working right now. So good morning, everybody. It's a pleasure to see you all today. First of all, great kudos to everybody last night who
Yes.
worked to get us through a very long meeting. We handled it slightly different than we had before. I thought that everybody pulled together, great teamwork by colleagues, by Susan and all of her staff, and by Jim Tambora getting us translators. I think it worked out really well. And I know both Tony and I are interested in hearing from people what they thought, and we may replicate that in future long hearings. So we're ready to move along. We're starting off with the Office of State Comptroller. Marty, are you leading this?
No, Comptroller Natalie Braswell is leading
Oh,
on the call. I'd like to introduce everybody to Comptroller Natalie Braswell, who took office right after the first of the year on January 1st.
Well, we've met Natalie before. We're very pleased to have her here today. So, Commissioner, if you want to give us just a broad outline, but what we've generally done on these meetings is gotten into the habit of using most of the time from questions from colleagues. So,
do you want me to start out?
Yes, please.
All right. So good morning to you, Senator Johnson, Representative Walker, Senator Minor, Representative France, and all the members of the Appropriations Committee. Thank you for the opportunity to have us join you here today. We've submitted testimony for your review that includes some important updates from the Comptroller's Office, including our work to implement new financial relief programs for essential workers who suffered hardships related to contracting COVID-19, the status of cost-saving initiatives in the state healthcare plan, and our preparations for the anticipated surge of state employee retirements. Instead of reading the testimony today, I've asked some of my key staff to join me to answer any questions that you might have. We have with us today someone I know you're all very familiar with, Deputy Comptroller Martha Collison, Assistant Comptrollers Josh Wojcik and Tara Downs, Director of Healthcare Policy Tom Woodruff. We have Raylan Roy, who's Assistant Division Director for Healthcare Policy, John Harrington, who is our Director for Retirement Services, Betsy McDermott, who is our Legislative Liaison, Callan Mercier from our Budget Office, and we actually have one of our actuaries on the line, John Garrett, for any questions that you might have pertaining to SERS and our actuarial evaluation. If there are any questions that we need to take back for research or any additional questions or documentation that you might need after, please don't hesitate to ask and reach out to our office. Thank you again for inviting us here, and we welcome any questions that you might have.
Thank you very much, Commissioner. And I'll start off with Representative Walker.
Good morning, Natalie. I'm sorry about that, my phone.
That's
good to see you. Good to see you again. Yes, that was my ring-a-ling-ling. But anyhow, thank you for joining us today. And one of the things that we've been asking for from each agency is a list of questions that pertain to your vacancies that you have in your office. Do you have requests for employment positions in your office now? And have you had some in the last year? Where are they? What are the statuses and the ones that you've had for last year? Because I know I just added that in, but part of the thing that I found out from some of the agencies was that it took a while for them to get any of the positions filled, even the ones that they started when HR took effect in Department of Administrative Services. So can you tell me just broadly, how many retirements? I know we talked about this before, and I think you said overall you think the retirements are only going to be about 4,000. Has that number changed for you at all?
Well, total, we know that there's about 12,000 individuals statewide that are eligible for retirement. In terms
Okay.
of where we are right now, I'll hand that question over to our Director of Retirement Services, John Harrington, who'll be able to provide you some more detail about where we are currently in terms of the number of retirements that we've received, retirement
Okay,
applications.
great, thank you.
Yes, good morning. I'm John Harrington, and I would say that is the question that we are focused on in terms of what the number of actual retirements will be. It's something that's unknowable at this time because it requires individuals to actually make that election, and people have all the way up until June 30th to make that election. What we've done, however, is we focused in on that population of approximately 12,000 individuals, and we have categorized those individuals based on different factors to kind of predict which individuals are more likely to retire than others. And that's our best approach at anticipating what the number would be. In terms of concrete numbers, we also, in connection with the DAS pod, we are in communication with the different agencies. So as soon as individuals declare their intention to retire, they notify us of an intent to retire, and we can start working on those cases in advance so that we would be in a position to deal with the surge as best as possible. We actually just incorporated our new intents to retire that we've received in office for the week right now. And that total number is just under 2,700. So we have individuals who have submitted either an intent to retire or an application to retire between now and July 1st of 2022. And that number stands at 2,700. We have over 1,000 intents or applications for April 1st. We would predict that July 1st is going to be the heaviest month. And as it stands right now, we still have less than 200 intents for July. We expect that there's going to be a very large increase in that number going forward.
Thank you for that. So I just want to try, because you gave me a group of numbers that I'm trying. So theoretically, you have potential for 12,000 people to employ. Is that correct?
Correct. Those are our individuals.
To retire. I'm sorry, 12,000 to retire. Correct.
Correct. Those are individuals that would meet the eligibility criteria, some of which are far more likely to retire than others.
Okay. And as far as the ones that have retired, I didn't hear that number, but the ones that you think you have going forward, where you think are you starting to get, have sent in intend to retire, it's been about 2,700.
Correct.
And how many have retired already?
Right. So how many have retired over the past? We had 356 retirements for January. We had just under 270 retirements for February. We're still dealing with retirements for March, but over the past at least 18 months, most, if not all of those numbers have exceeded the 10-year average for retirements. We've seen an uptick in activity in most months since we've gone out for COVID.
Wow, that's scary. So I guess what my question would be to Department of Administrative Services, if they're listening, if we've got 12,000 people, how are we going to cover that? So that makes me extremely concerned. Thank you. Thank you, Madam Chair. I think I want to ask some more, but I'll let other people have a chance since we only have a few minutes. So thank you.
Thanks. Senator Lesser?
Yes, thank you, Madam Chair. And just briefly following up on Chairwoman Walker's questions, just one, obviously getting, it seems like facing we knew there was going to be a silver tsunami this year, but one thing that seems clear is that the spate of retirements has been faster, or at least earlier than we thought. But getting sort of real-time data seems really important. Are you sharing that sort of on a weekly basis with OFA? As we get closer to the appropriations deadlines, I just want to make sure that we're continuing to sort of monitor this. So we have, a real way to sort of factor into the state budget. And then I've got a question, if I could, about fringe afterwards, but.
John, I don't know if we've had communications with OFA about, I mean, we're in contact with DAS about these numbers. And so we're communicating in that sense. I'm not sure about sort of information that's going outside of the relationship between DAS and us in terms of keeping track of that number. John, I don't know if you have other information on that.
Yeah, well, all I would say is I certainly don't have a direct line to OFA sending this information on a weekly basis. There have been instances over the past couple of weeks and months where there's been a request for information that we've responded to. It's not as though I have any objections to setting up something more formal and providing this information going forward. And I think that that's something that we absolutely could do if that's going to be helpful.
And do you expect that the retirements are going to continue right up until June 30th? I'm not sure what sort of modeling you're doing, but is this something that we're going to see a likely ebbing as we get closer to the deadline, or do you think you really don't know?
Yeah, I would say that I absolutely do not know. I would predict, however, if this is similar to other, either silver tsunamis, retirement incentives, changes in benefits. Typically, there's a large portion of the population that does wait until the last minute. So we would expect that there would be a great deal of activity towards the end. There might be people that are on the fence. They're not willing to really make the call now, but as they get closer, they would make the call. And we are attempting to communicate with the populations because from our perspective, we can process the paperwork more efficiently if we have lead time, and that would lead to better interactions with the retirees. So there are a number of reasons why it would be in an employee's best interest to provide us with the notice as soon as possible, and we're attempting to encourage that. But I do think that, the way that this has worked out in the past, we would expect a large number of employees at the end to submit those applications. How large that population would be, I don't know.
So, and then with regard to fringe, one of the big issues of the session seems to be hospital consolidation and how that's affecting the whole healthcare market. As the biggest payer in the marketplace, I just was curious. I was looking at some data this morning that suggests that in places where there's been substantial consolidation, costs can be 15 to 16% more on average. And I was just wondering if you see a role. And Comptroller Braswell, it's great to see you. We miss our dear friend Kevin Lembo, but I know you're doing extraordinary work in this role. So I just wanted to see if you had thoughts about whether or not the Comptroller has a key role in this specific area about consolidation and the health insurance marketplace.
So I'm going to turn this question over to Josh Wojcik, who I know, Senator Lesser, pretty well, to address the issue of consolidation as it pertains to fringe.
Yeah. So hi, Senator Lesser. Yeah, I think as you probably know, the literature on consolidation nationwide would indicate that once a hospital group has increased bargaining power, they tend to use it, and costs tend to rise. Relative to what we're seeing in the marketplace right now, I don't have a specific analysis that could be provided relative to where we're seeing cost increases, but certainly the areas where we've seen some of the largest jumps on a percentage basis in terms of reimbursement changes are in inpatient and outpatient hospital. So that continues to be a concern relative to the overall costs of healthcare, and something we continue to monitor.
Thank you very much. Appreciate it. And thank you for the committee time.
Thank you very much, Senator. So I just want to, based on Senator Lesser's questions, if we could get information I think Senator Walker, Representative Walker and I will come up with a list of questions that we would like to hear from the Comptroller's office on a regular basis. I'm not certain if weekly is necessary, but certainly bi-weekly through the appropriations JF deadline and before we vote on the biennium budget, so that we are dealing with real-time numbers. We might come up with some things. Up next is Representative Dathan.
Thank you very much, Madam Chair, and really nice to see you, Comptroller Braswell. I know we haven't met yet, but hopefully we'll get to meet in person at some stage soon. Thank you for your testimony today. I had two questions. The first was really regarding the Connecticut Essential Workers Relief Fund. Do you actually have any data to talk about the applications? I know it's relatively new, and just wanted to hear a little bit more about that program and how much money we have in there, and what the sort of indication is based on applications that we've received in January, to make sure that our essential workers are getting the reimbursements that need to cover their lost wages, out-of-pocket expenses, and other sort of expenses that they may have incurred.
Okay. Happy to provide a little bit of information on this program. As you may or may not know, we launched the program January 3rd of this year. It's being offered to all Connecticut residents who are categorized as essential workers between March 10th, 2020 through July 20th, 2021. That's the time period for eligibility for those individuals that contracted COVID-19. And as you stated, the fund is there to reimburse them for lost wages, out-of-pocket medical expenses that weren't necessarily paid for by insurance, and of course, burial expenses that where the death was a result of their diagnosis for COVID-19. We are partnering with a vendor, the Public Consulting Group, PCG. Right now, to date, we have about 1,458 people that are registered for the program. In terms of applications that have been submitted and completed, it's about 168. In progress applications by applicants is about 432. And when we talk about in progress applications, we're talking about people that have registered but might need to submit documentation evidencing the lost wages or the medical expenses that they need to be reimbursed, or maybe uploading a death certificate for the funeral expenses. To date, again, just throwing out there that the program did only launch on the 3rd. We have about 3 approved applications, and we expect that those numbers are going to increase, and money will begin to start being paid out within the next couple of weeks.
And sorry, what was the size of the total fund? I missed that.
$34 million.
34 million. Okay.
And the fund is on a first come, first served basis. So
yeah. Okay. And so once that fund is complete, then
once the money,
applications.
Correct. Once the money is depleted, it's depleted.
Okay. Thank you. The second question I had really was talking about reduction in healthcare costs. I know the Office of Comptroller has been forefront in trying to offer programs that will really be instrumental in lowering the cost of healthcare. Do you all have any sort of reports or any sort of analysis that you have done for some of the different programs, in particularly the CT partnership plan? I know you said it continues to grow in enrollment. Just wanting to know about what sort of statistics we have in terms of how much we're actually saving municipalities, and what the sort of historical experiences and what the sort of trends seem to be going forward.
So our office did just put forward a report, the latest report on sort of the status of the partnership plan, and we'll be happy to get this group a copy of that report. In terms of like enrollment, we're looking at about 63,000 enrolled employees and dependents from about 153 different groups. No group has left the plan since the plan has started. In terms of the financial status, when you look at the report that we just submitted for fiscal year 2021, our medical loss ratio is 91.2%. What that means is that the premiums that we're taking in are completely paying for the claims that have been submitted through the partnership plan. And there's, a lot of other really great stats and numbers in that report, but happy to talk about anything specific that you'd like to see. I'd like to point out that, the benefits of the plan is that it provides for lower costs to be achieved by smaller groups alone, and lower costs for us are achieved through lower administrative fees, 2.9% for fiscal year 21 and 2.4% for projected fiscal year 22. We're talking about things like improved drug discounts that achieve, through the state's bargaining power, carrier network discounts, same coverage for teachers, first responders, and other municipal employees. The same type of benefits that everyone else enjoys is being given to, our firefighters and our teachers and our healthcare and first responders in these municipalities, our police officers. So those are the groups of individuals that the partnership plan is serving.
Okay, that's great. If you can make sure that Sue Keene, our administrator, gets a copy of that report so that we can have a look at that. But you answered some of the key questions that I had about that. So thank you so much. And thank you for your testimony, and thank you, Madam Chair.
Thank you.
Thank you very much. And just taking off of Representative Dathan's questions, were there any federal dollars that were used to offset any losses, both in the partnership plan and the healthcare plan for state employees, relative to COVID expenses or whatever else? So CARES Act or ARPA dollars or any other federal dollars concerning either the partnership plan or the healthcare plan?
Yeah, so I can finish out the question on the partnership plan, and then I'll look to Dr. Woodruff, Ray Ellen, and Josh to talk more in depth about the healthcare plan and federal dollars that were used there. At the close of the calendar year, there were certain federal COVID funds that were set to expire. All state agencies were asked if they had qualifying COVID-related expenses. Our office had previously received reimbursement for COVID-related costs for the state plan and proposed the same for the partnership plan. The funds received are directly attributed to medical claims for COVID-related testing and treatment. The funds, were for the purpose of reducing the required premium increase for partnership group for next year. And because the premium calculations for partnership in the state plan are pooled, pursuant to state statute, the additional funds will also help reduce the premium increases for the state plan. The overall result was the reduced cost of the state and municipal budgets, benefiting state and local taxpayers who would otherwise have not been covered for these unanticipated costs related to COVID. And I'll go ahead.
So how much do you, I'm wondering, do you know what the dollar amount was?
Josh Raylan, do you know what exactly the dollar amount was? I want to say 40 million, but I also don't want to misquote.
You were almost right on the money. With regard to Partnership 2.0, it was just shy of $40 million. For the Active Health General Fund and for the Retiree Health Fund, it was 36.1 million for active employees and 10.6 million that was received for retirees as a direct offset to claims attributed specifically for the testing and treatment of COVID.
And I apologize, I'm in my car, not because I'm driving anywhere, but because I'm charging my phone because I turned on my outside lights. I'm waiting for them to come on so that I can know I have power back. So I apologize, just so people know. Commissioner, were you going to have somebody else answer another part of that question, or can I move on to Representative McCarty?
I think you had asked the question about the healthcare plan, the state healthcare plan. I don't know if that was answered for you sufficiently or if you need more details.
No, I think I think I have the dollar amounts. That's what I was looking for, is the dollar amounts. That's helpful.
Okay.
Representative McCarty?
Yes, thank you, Chairman, and welcome, Controller Braswell. It's nice to see you today.
Thank you. Too.
Thank you. If I may just, and I should know better than go behind Representative Dathan because she's always asking questions on what I'm thinking about. But if I could circle back to the COVID relief program for one moment. I know it's on a first come, first served basis, and there's 34 minutes. Is there a time frame that was set on the applications? And also, does your office offer any assistance? Because I've heard from some individuals that the application process itself was somewhat cumbersome for them. So that's just a quick question there.
So I'm going to turn this over actually to Betsy McDermott. She has done a yeoman's effort in putting together this program and the administration of it, to have her sort of talk through what we're working with PCG to do to address some of those issues that you're talking about in terms of applying for the program. And there is a time frame. Betsy, if you can give us that date really quickly.
Yeah, so Representative McCarty, thanks for the question. So we went through a pretty tedious ramp up relatively quickly to get this program up and running because it's brand new. And so we've run into a little bit of challenges along the way. And we're like Natalie said, we're addressing those as they come along. And our office is kind of a liaison between those applying and our partner with PCG. So we're working through those issues. So the deadline, the program will end once all of the monies are depleted or by July 2024. So that'll be the end date for that group of folks who were affected between March 2020 and July 2021. And if there are specific challenges that your constituents may have, you could certainly send them my way. I'm happy to help figure those issues out. We're actually meeting today with the labor chairs to kind of talk through some of the challenges that we've had and work to resolve those. So again, happy to have folks reach out to me directly. I am a program manager for the OSC on this project. So happy to help in any way moving forward.
Thank you very much, Betsy. I appreciate that response. And then just very quickly on the program, the new Network of Distinction program. Do we have any idea about what the cost savings might be to the state? And that does not impact in any way the quality of the care. If you could just comment on that for one moment.
Josh or Tom?
Yeah, I can comment on it quickly. So Network of Distinction program, for folks who don't know, it is a program in which state employees and members of the partnership plan can receive incentives for utilizing high quality, efficient providers for procedures such as knee replacements, knee surgeries, those types of things. And so within that program, the general concept is that if our members utilize these high quality, efficient providers to mutual benefit, they'll have better outcomes, less medical errors, et cetera. And the plan will achieve savings, and therefore an incentive is put in place associated with that. Relative to savings, we don't have specific savings numbers at this time, but the program over the last year, well, I guess 6 months or so, has grown significantly, and we hope to soon be able to start to evaluate what the actual impact is as we get to utilization numbers that are adequate for reasonable analysis. So right now we have about 1,400 individual providers that are participating in the program. And we cover about 23 different procedures that are eligible for incentives. So it's a program that is recently, I think, got to a level where we'll be able to start to see utilization that has some statistical significance to it. So hopefully we can be back sometime soon with some more analysis on that front.
Okay, thank you very much, Madam Chair. Thank you.
Thank you very much. Representative Baker?
Thank you, Madam Chair. Good morning, Commissioner. Good to see you, and congratulations.
Thank you.
Yeah. And I apologize if this question might have been asked because I was having a little technical difficulty. So excuse me if it was answered already. But when we talk about the judges and the compensation commissioners, pension system and stuff, there is a reduction in there. And so can you elaborate a little bit on that? And due to the reduction, was that money sent somewhere else?
Are you talking about a reduction specifically for the judges' pensions?
For the pension, the retirement system.
John, do you have any information on that?
Sorry, I was muted. Yeah, I'm not exactly certain what the reduction is that we're.
I think it's like
sorry.
It's like about 2.6 million. Because there was like 180 for active judges and 330. If you look on page, what page is it? Page 12.
And the document is on the judges' pensions valuation report?
That's correct.
John Garrett, can you address that?
Yeah, good morning. This is John Garrett with Kavanaugh McDonald. The judges' system had some slight gains, primarily driven by the investment return for the year, which is going to reduce the actual determined employer contribution, the ADEC, for fiscal year 2023. So it was really an experience-based reduction due to some good news on their plan.
Yeah. So. So although the money was originally, I believe it was that just taken out, or was it sent somewhere else in terms of to make up a difference in a line item? So.
I'm not sure, Representative Baker, who would you want to answer that question? Is that for the comptroller, because the actuary wouldn't know what happened just because there was a benefit. So
they wouldn't know. Okay.
That's not their. That's not they know the plan, but they don't know necessarily where anything went, and the money doesn't go anyplace else unless
it is.
Unless we allow it to. So we'd have to go to an FAC meeting to transfer the money to another line. We haven't done that yet.
Okay. All right. Yeah. Thank you, Madam Chair. That's all my questions.
Thank you. And we're reaching the end of our time frame. And so just very quickly, and we may need to have another meeting with the actuary, seeing as you brought the actuary here. The judge's plan is what % funded?
John, do you have that number, John Garrett?
I'm sorry, I'm trying to pull it up right now to get the exact number. I'll have it in just a minute.
Thanks so much.
Okay. So John, while you're looking at, can you look up all 3 plans? Is it just the 3 plans, teachers retirement, SERS, TERS, and the judge's pension plan?
Yes, ma'am, I will. Why don't I raise my hand when I have all 3 of those? And you can.
That'll be good. We may bring you back when we're gonna, Madam Commissioner, if you want to give a few last words, that would be great.
Again, just want to thank everyone for inviting us to this meeting and asking the questions that you asked. I hope that we've answered your questions fully. Again, if there are any additional information or additional questions that you have, and any reports or other documentation that we can provide to you, please just let us know and we will provide it as quickly as we can.
Thank you. We may ask for a special meeting with the actuaries on all 3 plans so that people understand what's going on, because with the amount of money that we're putting into them and the return on investment, as large as it is, we want to understand all the complications relative to the numbers that are coming out, in particular relative to the number of retirements, the payroll, all of the different tenets of how someone comes up with where the plan is. So if John wants to stay on while we go on to the Department of Administrative Services to give us those 3 numbers, that would be great. And I'll call on him as soon as he has those 3 numbers. Thank you very much, Commissioner. Pleasure working with you. And I hope I didn't miss any calling on anybody, but I'm working off my phone right now. So have a nice morning.
Thanks, everyone. Have a great day.
Thank you. I think up next we have Commissioner Michelle Gilman. Commissioner. Is Michelle on?
If she's not, she will be in a few minutes. Let me text.
She's in the queue, Madam Chair.
Yes, good morning. Hi, this is Eleanor from DAS. I can attest that Commissioner Gilman is here and is ready to begin. It appears she's having some technical difficulties. I can check on that right away.
Thank you.
It's possible, Madam Chair, that Colchester may have some internet outages. I don't know. Or same issues that Senator Austin is having with electricity.
Can you hear me now?
Same issues that Senator Austin.
Kathy, John Garrett is available.
Okay, John, go ahead.
Yes, ma'am. So I'm sorry it took so long for an actuary to come up with 3 numbers, but I hope I haven't shaken the confidence of anybody. But As we know, the SERS funded ratio based on the 2021 actuarial valuation was 41.6%. The judge's plan, again, based on the June 30, 2021 valuation is 57.4%. And the teacher's plan, which is based on the 2020 valuation, so 1 year prior, and doesn't recognize any of the big investment gains, is 51.7%.
And the reason that is not done for the tours is because that we only require them to do it every 2 years.
That's correct, ma'am. Statutorily, it's a biannual valuation, and our contract is to perform biannual valuations.
Okay, thank you, because we may be changing that so that we can stay on top of what the actual numbers are. Thank you so much, John. Appreciate it. Is Michelle on?
Good morning. My apologies.
Hey. No problems.
So,
so Commissioner, what we usually do is we have you give a couple of opening comments, and then we open it up for questions from colleagues. And just so you know, I'm working off of my telephone because out here in Eastern Connecticut, there's a couple of spots without power. I hope you had power in Colchester.
Thank you. Yes, Senator. I was thinking about you this morning. We were fortunate to have power, but I was thinking about you and other members that may be experiencing those challenges today. And thank you again for the opportunity to join you and the committee today, Representative Walker and the team here. I want to acknowledge certainly that I have a team of experts from the GAS agency that are joining me today. And again, I apologize for the technical difficulties that I had. I was in the meeting, but you could not see or hear me, so I apologize for that. 5 days into the job, I'm still working on finding out where the pencils are and connecting into the various technological resources. So my apologies, but look forward to the conversation today. And again, I'm happy to take your questions, recognizing that you may have many for GAS. And again, want to recognize that our full team is here for HR, IT, procurement, our fiscal team, and others. Bob Giudetta from Workers' Compensation. So ready to take your questions moving forward. Thank you.
Okay, so I'm going to assume that I lost my co-chair. Her car may have stopped. I don't know. So I'm sure she'll join me when she can. So I want to welcome you, Commissioner, for joining us, and thank you very much for giving us this time. I'll start out. I'm sure I don't know. We were talking with the Comptroller's office just before your agency, and I asked the questions about the retirements, and I asked them, what are the projections, things like that, and then they also explained to us that every month they have a tally, and they've got a tally now. So the projection is about 12,000, and with that number, that's huge for the number of state employees. What is your agency doing? First of all, do you get those projections from the Comptroller, and does that then help you focus in on processing enrollment or hiring requests that come from those agencies, and how long does it take for you to get them?
Certainly. So thank you for the question. Of course, the retirement surge is of top priority for the GAS team and obviously our agencies statewide. And we continue to work diligently across all of our agency partners to ensure that we're not only processing retirements in a timely manner and working with our employees to provide them with information in order to make the right decisions for their personal situations, but then also looking at the refills that are required to make government continue to run efficiently, and also provide the services that our residents need and deserve. With respect to the Comptroller's figures, and I'm fortunate enough that I worked for the Comptroller for about 10 years and worked deeply with the retirement division, the healthcare benefits division, and others. And so I've seen firsthand for several years that DAS has been in lockstep with the Comptroller's office in terms of projections and preparing for the so-called silver tsunami. And now we're at this critical point, and I can share that we're in constant communication with the Comptroller's leadership team, and then also our benefits and leaves team at DAS is working hand in hand with the retirement division staff on a daily, if not hourly basis to monitor the numbers, the applications coming in, and working through the approaches needed to process those, especially looking at April 1st and then July 1st as well. With respect to the numbers, I do want to make mention that while the 12,000 number is indeed the number eligible for 7-1, under the DAS umbrella of executive agencies, we're looking at closer to 7,268 eligible retirees under the executive agencies. So it's a reduced number, but obviously significant. And we continue, as I indicated, to look at our processes and procedures, continue to look at how we can work with the Comptroller's office in partnership to make this as smooth as a transition, not only for the employees, but for our agencies. And then on the flip side, in terms of recruitment, also ensure that we're recruiting quickly, in particular for those critical positions that our agency partners are identifying. I hope that answers the question, Representative.
Yeah, sort of. So your projection is about 4,000 less than what the Comptroller's projection is right now. How many? Okay, they've said that they processed approximately 4,000 already.
Mm-hmm.
So if we take your ratio, how many jobs have you filled in the last year in DAS for employment?
So in DAS in particular, we have kept so overall, let me provide that. Again, just going back to the Comptroller's number of 12,000, when they're looking at the entire processing for the state, we as DAS are not processing retirement applications for UConn or judicial or legislative management and some of the other branches. So that's where the discrepancy comes into play, where those branches or those agencies are responsible for working with the Comptroller's office directly on processing those. So that's where that difference on the figure comes from.
Okay.
And then overall in the executive branch agencies, we're seeing a steady state in terms of our executive employee count at about 30,358 employees just as of yesterday. And that number is staying relatively stable over the last few years. And so we're very focused on, as those employees leave service, hiring and recruiting, again, for those critical positions and those positions that the agencies have identified for refill as quickly as possible. And I'm going to turn to Nick Herms, who's the director of our human resources statewide, for the number on statewide or for DAS.
Okay, we spent, okay, we have to move a little faster. So Nick,
Okay.
just what's the number? Sorry.
Good morning, Representative.
Good morning.
Thank you. So the specific number for DAS is 63. For the agencies under the jurisdiction of DAS, the figure is just over 4,000. It's 4,035 positions so far as of yesterday. So we're on pace to fill 6 to possibly over 7,000 positions this fiscal year.
Okay.
And that is the most that these agencies have filled in one fiscal year in the past decade.
Could you give us a 12-month projection on how, let's say a year ago from this time, how many positions you filled and in what agencies, so that we can see those numbers, please, in the working subgroup? Okay.
Certainly.
Thank you. Thank you very much. Thank you, Madam Chair. Are you back or do you want me to stay?
I'm back, I think. I don't know.
Okay.
Representative McCarty.
Yes, thank you very much, Madam Chair. And I apologize, I will have to leave. We have an education committee meeting coming right up. But I did want to say to the commissioner, I'm very pleased to see in the testimony the information about the grants for the indoor air quality from the funds. I just curious as how did that $90 million total, how was that derived? And then going forward, if and when we have more information on the matching grants and how that will be determined. So just, and we can get back for that information going forward. I know it's a great concern of everyone and it probably requires some ongoing discussion, but just that 90 million, how was that derived?
Sure. So I'd like to identify Bill Petra, who many of you may know as our Deputy Commissioner of Construction Services. He and his team have been working closely with OPM and the Governor's Office around this program, looking at past initiatives under the legislature as well, and what may make sense for a program moving forward in the sense of a grant program, potentially a matching grant program. The 90 million figure is really a starting dollar figure, and we look forward to the continued discussions as we move forward on what makes sense for for funding and how to approach this program. But Noel, obviously pivot to you for any additional comment in terms of the budget conversations around this.
Sure. So this has come to light over the last, since we took over OSCGR. We've gotten a lot of feedback from the different districts. The most common feedback was, can you help us with HVAC? And then when we met with the education committee, again, they reiterated the need for this. And interestingly enough, it came to the governor's attention, or at least to Josh's attention, months ago when he started asking me about it. So it's kind of come to the surface because of COVID. And I think now is the time for sure to put this program together. I think 90 million is a good start, and we have already started working on modeling the program at kind of a basic framework. Obviously, we'll work with the education committee and with our other partners to put the actual program together, but we'd like to model it similarly to our roofing policy, which is it's not a priority list. It is a month-to-month application. It has set criteria based on age and condition, et cetera, and so forth. It'll have to be designed. We have to put criteria together to make sure that the most needy schools get the most attention the quickest. So we're looking forward to putting that together with the education committee and the rest of the partners.
Right. And I just wanted to follow up by just saying, I appreciate hearing you say that this is a start and that we're going to be moving forward. Okay. Thank you very much. And I apologize that I have to leave. Thank you.
Thanks, Representative.
Thank you. Thank you, Representative Baker. You're up next.
Yes, thank you, Madam Chair. I have a good morning. I have a question in regards to when you're looking at the workers' compensation claims. I was looking at the I guess the increase on the COVID claims, and there seems to be some sort of variance. I mean, is each department that's based on the amount of claims? Is that correct? And do you have a breakdown of the amount of claims? And
Hi, Representative Baker. This is Bob Jadida. I'm the DASHR Administrator for Workers' Compensation. You're referring to what number, if I may ask?
So as I look at some of the claims in the different departments, like university,
Sure.
Corrections,
Right.
I see such a high claims in other areas. So I was just kind
Absolutely.
of what your numbers were. Do you have breakdowns of numbers of each claims, or is that just is it just variance in the dollar amount that they pay out?
The variance may have to do with the payments that are made in the fiscal year. So there may have been claims in prior fiscal years, probably dating back to March of 20. Okay, when we started to see, reports of COVID claims coming into, our third-party administrator and those being reported. There's a variances based upon probably the different type of services that are provided by each and every agency. For example, healthcare may show a higher variance. DEMIS, Department of Corrections, Yukon Health Center, versus someone maybe over at Special Transportation or Department of Transportation. They're more in close proximity with clients.
So when they do the claims, so they're more or less on the would that be for compensation for days off or whatever, or just...
Those could be wage replacement benefits. It could be for medical benefits. There are indemnity benefits. So there are different type of benefits that we have to honor if we determine that COVID arose out of or in the course of employment or work relatedness.
Yeah. Now, does any of those monies come from the COVID Relief Fund? Any monies come? No.
No, it does not.
Okay, so it's pretty much
they come from our appropriation.
Okay, all right. Thank you. Appreciate it.
Thank you, Representative.
My pleasure. My pleasure.
Thank you, Representative Baker. Up next is Senator Lesser.
Yes, thank you, Madam Chair, and Commissioner Gilman, it's good to see you. Congratulations on condolences on your new position, and glad to see your team here. I just had a question about a couple of the consolidation efforts. One sort of backward looking, although there's something in the budget, and then one forward looking. I know a recent policy change was the consolidation of HR positions in DAS, and I see a proposal, which had been billed to us as potential, at least as one way as a cost savings, and I see a line item here to increase staffing there. So I was curious if we had failed to receive, if that means that we failed to see the savings that had been anticipated, and then sort of looking forward at a policy recommendation to consolidate IT services in DAS. Should we be concerned that are those two things analogous, or should we be looking at those differently?
Thank you, Senator, for the question, and good to see you this morning as well. So in terms of the HR consolidation, the goal of that consolidation, and I can let Nick obviously talk more broadly about this as well, or in more detail, was really to consolidate our HR teams really around the expertise and skill set that they brought to all of our agencies, especially looking at where we are now in terms of recruitment needs and then the retirement needs as well. So it was less about the cost savings and really more about consolidating those teams to to streamline processes and procedures, really level set HR policies and agency enforcement, I guess is probably not the correct term, but how we're implementing HR procedures across the state. Far more goals for that consolidation, overall. But where you're seeing the 13 position increase is really around recruitment. So continuing to focus on recruitment of personnel for our agencies, particularly with our 24/7 agencies, which require significant recruitment efforts to retain and attract new personnel. And we're looking at creative ways of attracting employees to our agencies, especially in this competitive job market. So that additional personnel will not only help with the recruitment of personnel, but also help to look at new HR programs that have come forward that we need to implement. For example, the paid family leave program will require additional staff, to help manage and implement that. A great program, and again, something that we certainly support and have helped implement. But we'll need, a couple more hands on deck in order to help support our employees through that process. Nick, anything else on the HR consolidation? And then I can speak to the IT consolidation as well, or optimization with Mark.
Thanks, Michelle. Good morning, Senator. So one additional item and reason for our position request is the upcoming split of our technical schools system to be an independent agency. So our position request in part is in so that we can give CTEX a full complement of an HR team. And then, for a lack of a better term, further support DAS, who will be assuming the HR support for the State Department of Education proper, plus the Office of Early Education.
Thank you. I did not know that. That's very helpful.
And then Senator, just quickly, I know time is of essence for the committee, for the IT centralization or optimization, as we prefer to call it. That is really a transfer of positions from agencies into under the DAS umbrella. So that's really just a straight transfer of those positions under DAS. So that's what you're seeing in that budget line item by and large. Mark, anything additional to add? And Mark Raymond, I think, as most of you know, is our CIO for the state. Thanks, Mark.
Thank you, Commissioner. Thanks, Senator. Just one clarification is just that the goal of the IT optimization was not necessarily cost savings. It's to help us become more efficient as the state relies more heavily on technology, both the technical skills of our employees and the depth of those skills. We see that increase every day. And this is an effort in which we knew that we could be more flexible with our employees and apply those skills more broadly across agencies, and really an effort for us to become more efficient and deal with this growth in technology and how we apply it. We did not set out, nor did we propose that there would be reductions along the way as a result of this.
Great. And if I could just have one quick follow-up, and I think probably directed to Mr. Raymond. I don't think there's a single or a set of state line I'm sort of related to cybersecurity, and I just wanted to see if you had a strategy insofar as it relates to the budget.
You're correct. There is no line item associated with that. Through OPM, we did generate an IT capital investment program last year to invest in cybersecurity. We're also working with our federal partners around an upcoming grant program on that. We have been using the capital dollars to improve, and all of our existing investments or expenditures have some elements of cybersecurity in it. It's one of my foremost concerns that we have, and making sure we put the appropriate resources on lowering our cybersecurity risk is something that we talk about almost daily.
Great, thank you. I have a bunch more questions, but I'll wait for the work sessions to have that back and forth in the committees.
Thank you, Senator. And Senator, I do want to comment for the committee at large that we do have a presentation we can share on the IT optimization that I think could be very helpful for this committee. So we'll be sure to forward that as well. Thank you.
Okay, don't go anywhere, Commissioner. I do have Representative Dathan that has a couple of questions.
Thank you so much, Madam Chair, and welcome on board. You've been amazing during the pandemic and helping support Norwalk. So everyone is very grateful for everything you have done.
Thank you, Representative.
Senator Lesser asked one of my questions, so I appreciate that, but really just wanted to kind of follow up, and apologies if this was asked earlier and I missed it, was really talking about the, Contracting Standards Board. We have, and Madam Chair, please jump in if I missed this discussion, and I can go back and watch the video later. But my understanding is, we've done a lot of consolidations for the IT optimization project, the HR system, and really combining our efforts to run more efficiently. I'm just trying to understand about the purchasing aspect of DAS and what we do as agencies. And it seems to me, based on my business experience, optimizing that would make a lot of sense. And I think, a lot of people think that there might be duplicative efforts between what's going on in the audit department. But again, that is sort of looking at things in hindsight. And I'm looking at things kind of more strategically and long term. And I'd like to understand how DAS is thinking long-term and strategically on purchasing and why DAS feels that the contracting standards board doesn't seem like something that we should be investing in to help us be more strategically and cost effective.
Certainly. Thank you for the question, Representative, and good to see you as well. So broadly, in terms of the Contracting Standards Board, the proposal through the Governor's Office, through OPM, is largely looking at how we can, avoid duplication of efforts, and also provide a balance of transparency, which you all, deserve and we all want. And so, this proposal aims to provide, to provide direction for both of those. So under the Contracting Standards Board proposal, looking to, place additional resources through the Auditors of Public Accounts, as you know, but we continue to support, additional efforts around transparency. Look forward to the continued conversation with you, with the legislature at large, the Governor's Office and OPM certainly as well around this issue. With respect to procurement, I would ask both Deputy Commissioner Noel Petra and then also Jean Burke, who is our Director of Procurement, perhaps to weigh in here. The two really do cross in terms of both construction services and then procurement. So Noel, would you like to start off?
Sure. So in case, for those of you who don't know, Jean and I both are responsible for some aspects of procurement. Jean has the bulk of procurement that is outside of construction, except for our master contracts and our on-call contracts. Definitely Jean does the vast majority of procurement. In our group, we only provide procurement for construction services for DAS and executive branch projects. And in that, we have a pretty robust system. If there are any questions about what we do with construction, I'm happy to answer them now. Otherwise, I'll hand this off to Jean, who is probably better prepared to answer that kind of larger topic.
Certainly. Thank you for the question, and I'm grateful for the opportunity to be here. Transparency is at the forefront of what we do. One of the things, I've only been with the department for the last 8 months. I'm thrilled to be here. One of the things that I inherited that I was very excited about when I joined was the introduction of CT Source as an electronic platform for bid solicitation and contract management, which I think provides a great tool for the transparency of all of the contracting activities in which we're engaged. And it's at the forefront of everything that we do. So at a very high level, adherence to the principles of competitive bidding and transparency are at the forefront of everything we do. I'm happy to provide any detailed information you would like relative to that.
Maybe, thank you, Jean, and thank you, Noel. Just really wanted to try to get an understanding how we have a review and oversight of procurement within the government agencies, because I do know that some of the agencies, are buying and procuring on their own, and presumably, obviously when you guys are ordering paper, for example, you order for all the agencies, but there are some specific things, and I do think that we need to be thinking about that, and I just want to try to get a better understanding how that oversight happens. And if we want to bring this to the working group, Madam Chair, I can see.
If
we could just,
and
sorry.
I don't want to.
Well, you're getting far into what would be the beginning of the biennium, and not that we have gone beyond our time frame again. So I don't understand your question. I'm not certain that you can make assumptions on any of this. So if you could write out your specific assumptions, how does somebody buy paper? How does somebody do this? How does somebody do that? So because you've already made some assumptions that I don't know are true. And so, I don't know that all paper for every agency is bought together. I don't want to get into that specific question right now. So write out everything.
Yeah, it was more of an illustration and giving an example.
Right.
So, yeah,
Right,
I
but,
understand.
then that's exactly what I'm saying. You're making assumptions that are being projected to the public when we're not asking the right question. So
Okay.
we need to ask the right question, and the right question is how is procurement done? What state agencies do you purchase for? So you come up with your questions, send them to the administrator, and we will massage that to see what we need to ask and send it over to them so that they can come to the working group with that question.
Okay, it was mostly to talk about oversight, but I will forward it to the administrator. Thank you, Madam Chair.
Thank you. Representative Walker.
Thank you, Madam Chair. I think what happened was you missed the beginning of the conversation, but I think that Representative Datham was questioning the stand that they had, that the agency had taken, that this contract standards board was not necessary because they already had their own established oversight. And I think that's a good issue for us to talk about it in the subcommittee, so that
Right.
we can get a better understanding of how it is processed, because we don't have too much oversight. We need to have continued oversight, and maybe an even more broad scope than what we have right now. So we need to sort of understand how it is, and we look forward to having that in the subcommittee. So thank you thank you,
Right.
Dean and Noel, and thank you, Representative Datham, for opening that. Thanks. Okay.
So I think we have our last agency in front. Commissioner, do you want to say a few last words?
I just want to thank you again for the questions. We look forward to the continued conversations. Happy to answer any questions, over email, provide additional reports. Looking forward really to working with you to provide the information you need over the coming days, coming weeks through session. So again, our team is available to you. Eleanor is not on camera because I'm at her desk, but please feel free to reach out to Eleanor and Michael as well, and she can help consolidate any of those follow-up requests that you all might have. But again, really thank you for the opportunity. Look forward to working with you, and have a great day. Thank you, Senator. Thank you, Representative and committee.
Yvonne, how do you put this on mute?
Oh, technology. Madam Representative Walker, are we up to OPM now? Have they been let in? I can't tell from my phone.
Let's see. I see.
We're letting Secretary McCaw in right now.
Right now. Okay. Good
morning, morning or afternoon. Morning.
Good morning. Good morning.
Madam Secretary.
Good morning. Good morning. I hear that you are working from the vehicle, but you're adapting.
I think it's what we all do nowadays, and so I keep going in and out of because apparently we're not getting power for at least another 3 or 4 hours. So
I'm sorry.
Me too. It is what it is. So, Madam Secretary, you already know the drill. We have, if you want to just talk for a few minutes, and then we'll be asking questions.
Absolutely. Good morning to everyone here today. Good morning, Senator Austin, Representative Walker, Senator Minor, Representative France, members of the Appropriations Committee. Always a pleasure to come before you to present the governor's budget and to focus in on the Office of Policy Management for the fiscal 2023 recommended midterm budget adjustments. You have a copy of my testimony. I'd like to hit a couple of highlights and then reserve the time for you to respectfully ask your questions. The governor's budget does propose to increase OPM's budget by $175.8 million. It's about a 48% increase. The primary drivers of this increase are related to an additional $160 million in the governor's proposal to reduce car taxes throughout the state of Connecticut, as we discussed last week. The proposal is to reduce the motor vehicle mill rate maximum from 45 mils to 29 mils. This would benefit more than 1.7 million motor vehicles across the state, and individuals across the state could see relief in their car taxes being reduced anywhere between 15 to more than 30%. The governor is also proposing a few adjustments in support positions. One, as you know, the Office of Finance, one of the divisions within OPM, has had a significant responsibilities in light of municipalities that are under oversight that need a little bit more support, as well as some of the audit functions pertaining to allegations that have occurred in West Haven. Also supports our work with our municipal CRF program. I do see the need to temporarily bolster staffing here to get through the next 2 years and to lock down these additional demands that are on the agency. There's a request for an additional position to support infrastructure. As you know, Commissioner Boughton is playing the role as our project management lead, bringing in coordination amongst DOT, DEEP, and DPH and other agencies. OPM is also obviously playing a coordination role along with Commissioner Boughton. We're requesting one position to help lead that coordination on behalf of the agency. That would be durational. And as the infrastructure funds are utilized and exhausted, obviously the position would go away. Other major requests for increases would be in our private providers account to address the benefits enhancement that we agreed to in the agreement. The cost did come in. The request came in higher than what we negotiated. We do believe some improvement on the amount of funds there would be warranted to get us to a better place. So from a general fund perspective, those are the major items in the ARPA dollars. One of the significant requests is pertaining to testing to ensure that the state is well positioned when needs come up. We do have our PCR sites. We ran into an issue in January and February with at-home test kits. The governor is requesting that he be in the position to respond to the public health emergency as needs come up for testing, PPE, and other related measures. So with that, I'm going to conclude my remarks and I'm available to answer any questions that you might have at this time. Thank you.
Thank you very much, Madam Secretary. Representative Walker, do you have any questions?
Thank you, Madam. Thank you. Good morning, Secretary. Good to see you. Thank you for your, I hope you're feeling better, first of all.
I am, thank you. That was a tough one.
Yeah, COVID is not fun. But I thank you for your questions. I was going to go to the employees in your budget. You asked for almost, I think, 55 new employees. Are those the ones that, in looking at what OFA has for you in 21 had 125 and now are going to 180. So I'm looking at that and trying to figure out where are these positions and for what purposes?
Thank you so much, Madam Chair. Just to be clear that the appropriated headcount for OPM in the general fund for fiscal 23 is 180 positions. We're asking for 2 positions. The change that OFA is recognizing is that in last year's budget, we reflected the centralization of the labor relations portion of HR centralization. You'll remember we reallocated from agencies the HR positions, they went into DAS, and the labor relations positions into OPM's Office of Labor Relations. And so that's a change that already took effect. The request is for 2 additional positions, one for infrastructure and one to temporarily support, provide some additional supports in our municipal finance division.
Okay, all right. So, switching gears on the ARPA funds, the ARPA funds that we had agreed upon in the previous year's budget. Did you put an accounting? Could you provide us with an accounting of where they are, and are they being paid? Have they been paid? Where they are, so that we know? Because, and the question I really have is why they took so long to get distributed.
Most definitely, Madam Chair. If you recall, the budget allocated for fiscal year 2022 from the State Fiscal Recovery Fund, $1.2 billion throughout the state. 560 million of that was our revenue replacement number to balance the state's budget. So if you pull that out, there was really about $600 million for fiscal 22 that needed to be operationalized. So just taking a step back on terms of process. At the time of the budget being enacted into law, we did not have final guidance from Treasury. Treasury guidance came July or August or thereabouts that gave clarity, which then required us to go line by line for each allocation to ensure that we could write a scope of work in these contracts or distribute funds in a way that adheres to Treasury guidance. That took us a little bit of time to do that, at which point we then gave the green light to agencies that they could begin the contracting process. In some cases, that meant reaching out to organizations and drafting scopes of work, formalizing that into contracts. We have obviously rules and internal controls that the state has to ensure that we're providing funds that have accountability built into that. And that's taken agencies some time to do that. However, I think we've made good progress. So for example, we have a report, and I'm happy to follow up. We have $300 million of funds. Of that, 600 million, when you take out the revenue replacement, the agency is implementing and has made available. We have 92 million that's been entirely completed or paid out. We have $60 million where contracts are still in progress. And then we have others where they're either in legal review. There's a memorandum of agreement that's in progress. I'd be happy to follow up and share that report with you. However, with this significant sum of money, you do have to ensure that the Treasury guidance is clear, that we are complying with it, and then that agencies are distributing funds that typically get formalized into a contract or a memorandum of agreement that demonstrates the compliance, that builds in the audit requirements for those organizations, and gets from the agency's drafting team all the way through AG sign off and review. And that takes time. We've made considerable progress here, however.
Well, thank you for that. I think this is obviously something new for all of us, legislators and administration, understanding how to give out the monies that we all agreed needed to go out in order to help the state in some of their dire areas. But the issue, I guess, was to me would have been to alert people that there were processes that were now being put in place, because a lot of those dollars were driven by legislators that were going into areas that they saw were having difficulty for a variety of ways. So I hope going forward, because we're getting the infrastructure dollars out and everything like that, that again, that the legislature be part of that conversation and helping to get people to understand how do they acquire those dollars once we understand how those dollars are going to go out. Because that lag time was very dear to a lot of people, and making change to try and recoup what we needed to from COVID. So I'll stop my questions right there, because I got my 2 questions answered for now, but I may come back. So thank you, Madam.
Thank you.
Senator Lesser?
Thank you so much, Madam Chair, just running for the mute button. And it's good to see you, Commissioner. Glad you're feeling better. Just wanted to ask a couple of questions. I see I know there's a lot of concern about oversight and what we can do there. And I see there's a position now for contracting and procurement oversight. I wanted to know if you could sort of speak to that. And then specifically with regard to the audits of ARPA recipients, are we just auditing folks run through state administered programs, or are we also capturing all pass-through funding that runs through the state?
Senator Lesser, always great to see you. Thank you for the well wishes. So for clarity surrounding the position that would function in the Office of Finance. The Office of Finance has multiple functions. It's responsible for overseeing municipal finance, particularly municipalities that are facing distress, and that work typically occurs through our role in the Municipal Finance Advisory Commission, which should really be that first step, that precursor to prevent a municipality from having to be having MARB oversight. So that is where we typically interact with our municipalities. We also have audit functions in the Office of Finance. We have procurement functions in finance. We have our STARS team that does a lot of analytical reporting for OPM as well as throughout state government agencies. So the position we're requesting really is going to focus in on the municipal finance side of the house. If there's needs to support procurement or contracting, However, there are a lot of per diem needs, if you will, that are coming through OPM that are increasing that book of business. We are heavily involved in West Haven at a more detailed level than traditional MARB oversight. The workload is not manageable. We do have Code Resnick that's supporting. I think it's important that we have additional staff to ensure timely responsiveness to any concerns that are raised. West Haven's a municipality that might need a little bit more direct support, and having folks go in to ensure that these internal controls are fixed. So that's what's proposed for the position. It really is emphasis on the municipal side of the house. And then with respect to the audit and integrity unit, I would note that in the Treasury guidance, the subrecipient and recipient monitoring for the local funds, so the funds that went directly to our municipalities, are a responsibility of the municipality. So I don't envision any of these dollars being used to do any auditing at the local level unless a concern is raised. And then at that point, we decide whether the state has jurisdiction. However, the ARPA Treasury guidance does state that recipients, so in the case, our state funds that we received, that we're responsible for ensuring that they're used in a way that's consistent with eligible purposes, that we're supposed to be monitoring implementation, ensuring record retention. So we need to begin to think about, as we distribute these funds and we build into the contracts with these subrecipients, their responsibility to maintain files and ensure they're using funds in a way that's consistent with the scope of work, whether or not we want to do some sampling or having a reserve in the event allegations come up of misuse. In the case of West Haven, we found ourselves in the position where there were no dollars allocated for this purpose. And instead, I'm pulling monies from within OPM to try to fund that. The state needs to be in the position that if any concerns arise, that we have audit funds allocated in this plan. And to the extent that we want to do some sampling in certain areas to ensure the funds are used appropriately, there's a resource budget in place. And so what you've seen is about $1,250,000 in the ARPA plan, so that there's a reserve to accomplish that. And I would note that Massachusetts and New Jersey have established a compliance plan that we will be putting together for the state of Connecticut, and these resources would be available to support that as well.
Great, thank you. And I know that every year this committee's traditionally had a back and forth with OPM on appropriate funding levels for the RSA accounts. I know we had one last year, and I see a major proposed change to RSA this year. I just wanted to see if you could sort of comment further on what's driving that, what you sort of see coming, and also to the extent that it's tied as well to projected staffing changes in state government due to silver tsunami. Sort of our questions of DAS earlier, just about making sure that we're getting real-time data about how projections are changing throughout the budget process.
Certainly, Senator. So first, let me take the latter. With respect to the silver tsunami, we did add 13 additional positions in DAS to address concerns with timeliness of hiring. I mean, we have obviously are in this period where the level of recruitment, the number of positions we need to recruit is going to be beyond the traditional amount that DAS and the agencies have to handle. So we believe that additional resources are necessary, particularly facing the retirement cliff. We obviously are also having conversations, as Senator Austin and others have raised, about particular job classes that are not competitive with market. And I won't go into details in respect for our ground rules. So the intent here is to really bolster DAS to staff up to be able to meet the needs of the agencies. And we'll have to continue to monitor. Agencies are certainly, certain agencies are really struggling with getting their hires through successfully. With respect to RSA, you will recall last year that we did not fully fund the impact of labor, potentially union contracts being negotiated at the point the conversations were premature. We had not gotten to a place of an understanding of where we might land with union negotiations. We are still in active negotiations. We're making considerable progress. We do expect to have some contracts to the legislature by the end of March at the latest. And therefore, we have adjusted the reserve for salary adjustment account to reflect what we believe the needs will be to fund those labor agreements. So as well as we've evaluated what we've seen historically for accrual payouts, given we're going to see a high period of retirements across the state of Connecticut. So the items that you have before you on RSA are really to address potential labor costs, accrual payouts, and any associated fringe related impact.
Thank you so much, Madam Secretary. And then one last question. I know I'm going long, but I did have a conversation yesterday with Senator Austin, and she noted a thing that I'm hearing a lot, which is that motor vehicle values have increased dramatically in the last few months. And so while I think I laud the intent of the governor's efforts to address motor vehicle taxes and sort of bring down the cost and save people money across the state. One thing that I'm hearing is that people are getting sticker shock, where they're seeing a huge increase in their car tax bills this winter. And I just didn't know if there was sort of aside from what the governor's already proposed, if OPM had any sort of ideas about ways we could provide relief to folks who are seeing a huge increase in their car tax bills, at a tough time right now.
Senator, we'd love to engage in some conversations about session to see if there are other ways to address providing relief besides the adjusting of the mill rate. And I'd love to bring Undersecretary Martin Hefton to talk about some other ways to perform assessments to address that. At this time, nothing on that particular issue, but the governor is committed to seeing tax relief in a tangible way. He really feels that car taxes are a way to do that. And if there are other ways we can address these concerns, we're certainly willing to partner.
Great. Thank you very much. I really appreciate it.
You're most welcome.
Thank you. Representative Baker.
Thank you, Madam Chair. It's good to see you, Commissioner, this morning. Thank you for
Great to see you, Representative.
Okay. I've got a couple of questions. The first one in regards to the private providers and how there was an increase. And I noticed that what the governor proposed and what we allocated, and then there was an extra 15. Can you kind of elaborate what caused that extra increase? Was that had due to the contracts and negotiations? Or?
Absolutely, Representative Baker. So Representative, as a part of the group home settlement last year, we did negotiate specific increases in wages. One of the other important features of the agreement and discussions and negotiations with 1199 was to address healthcare and retirement, where as you look across the group home providers, the healthcare plans, they vary widely. And so there was a desire to improve access to healthcare and make it more affordable. At the time of that agreement, we agreed to a $30 million benefit pool. It was $5 million in fiscal 22, $30 million in 23. So the cost would have to annualize to $30 million. As a part of that process, because DDS contracts with the providers, but the providers are the employers. So they maintain all the details on what healthcare plans that they offer. We then had providers submit requests to the Department of Developmental Services about changes that they'd like to negotiate at the labor table. Again, the providers are the employers that would negotiate and secure these labor agreements with 1199. And when we saw the magnitude of the request, those requests came at $75 million. But what also is important to note is you have some providers that have more generous plans and other ones where the plans were extremely costly for those employees. The request came in at $75 million against a $30 million negotiated benefit pool. So we believe in the spirit of those negotiations, if we're going to get to a goal of lifting those that have really, they have plans that are very difficult for them to afford, that to do so, additional funds are necessary. Doesn't get to the $75 million mark. The state didn't commit to a $75 million number, but we do believe some additional funds here are warranted. Our next step would be to engage with a healthcare consultant that would then take all those plans and really kind of come up with a baseline so we could determine how to equitably allocate the monies across the providers. Those are the discussions we've had with 1199 thus far. They were supportive of that approach. And the governor felt that additional funds to make progress on healthcare particularly would be beneficial to the overall goal of what we're trying to achieve, and hence the request for 15 million additional.
So in the upcoming years, maybe next year or so, we might see some reduction in that number if they make some adjustments on the healthcare. Because you said there was going to be a consultant reviewing everything. So you're looking at how you can make some adjustments now.
No reductions. So
Okay.
the role of the consultant would really be the one to bring in a healthcare expert consultant that would take all of the healthcare plans across all of these providers and these employers and begin to look at them and figure out which ones are really the worst off, if you will, where you have employers that the plan is so costly, they would never be able to access it. And they would recommend what is the fairest way to allocate this $30 or $45 million if you were to approve in a way that achieves a goal, which is to lift up those that have the most costly plans, and therefore they might not even be able to afford to have healthcare, and to distribute those funds equitably. It won't result in savings. It'll just allow us to properly allocate those dollars in a way that the employers and union can agree to, and that would not exceed the amount that the legislature would appropriate for this purpose. But it would not achieve any savings. It would help us to honor the commitment in a way that is equitable.
Okay. All right. Thank you for that answer. So my second question has to talk about the cemeteries where there was some neglect, and there was like a 75, I believe it was 75,000. Now, do you have a list of those cemeteries, or what triggered that they needed to? And then also, yeah, go ahead. What triggered that?
Absolutely, Representative. So Connecticut General Statute 19A-308B established the neglected cemetery account, and it authorizes OPM to make grants to municipalities where there are burial grounds and cemeteries that are not owned or maintained by an organization. And so that program has been in place for many years. The funds that we provide allows 4 types of work that can be reimbursed with these grant funds. It's to clear weeds and bush, to mow the grounds, to repair fencing or walls, or to straighten out the stones as they shift over time. The revenues that support those grants come from the death certificates. So those funds that are received by DPH for death certificates go into this account. And then there's a known list of neglected cemeteries, and the funds then get distributed. If I look back historically, depends on how much we get in death certificate revenue. In 2020, there were 37 awards at $3,332. So it's an equal distribution. The amount we're giving these cemeteries is very small. We do have surplus available this year. We thought it would be an opportunity to put an additional investment out to support neglected cemeteries throughout the state of Connecticut.
Who manages those funds and releases them? Do they directly come out of you from your office?
They do. That's handled by our intergovernmental division, our municipal division. They distribute the funds along with our division of administration.
Okay. All right. Well, thank you. I appreciate that. And one last question. And when we Project Longevity, there was an increase going to Hartford, I believe, for a position. And then how did that fall into play? Because I know that each city was allocated a certain portion of money, and I'm just wondering how that was able to. I mean, Hartford specifically was able to get an increase based on what? And then I noticed that that Waterbury wasn't listed. I don't know if it's just a typo or what, but Waterbury wasn't listed. I believe Waterbury was supposed to be implemented in there.
Yes, that is correct, Representative Baker. Waterbury is now included in the program. They've made considerable progress over the years. They really are in the planning stage. We're getting ready to hire a coordinator. There might even be an offer letter in place. It's been a lot of coordination between the local PD, the community, and we're going to be bringing in the training and the nationally recognized model to get all of their team members trained up. So we're making great progress. There's $252,000 in the fiscal 22 budget between some use of surplus, a carry forward use of surplus, and the appropriated dollars. So Waterbury is getting the same amount as the other locations, Hartford, Bridgeport, and New Haven. So they're operationalizing the program. We're glad about the progress. The additional monies that are here are really to take the staff. Some of the staff in these municipalities were functioning as contractors, and to make them employees of the Justice Education Center. One, it helps with retention, right? So they actually will be staff with the associated benefits. It also allows the Justice Education Center to play that fiduciary role for all sites. So that means we'll have greater consistency in reporting, making sure everyone's getting, having the same expertise, that they're doing the data analysis and collection so we can analyze, but we're making progress. We thought that was important, particularly after some of the challenges in Hartford, where we did not see communication and coordination occurring between the coordinator and the city. And so we want JEC to play that role. That resulted in fringe benefit costs because now they are employees, they are fringes that are associated. We did not want to cut the program funds, right? So we felt if we're going to cover the fringes, we should add those dollars in so that the programmatic expenditures that you have appropriated are not reduced, meaning we don't want the services to go down just because they're now employees as opposed to contractors and have fringes. So we recommend an adjustment of $175,000 to cover the fringe costs.
So this position is more or less working for all of Project Longevity in the sense.
Yes, it's all the staff now
Okay.
will be employees of the Justice Education Center. And so we can see greater uniformity and address some of those concerns that happen.
Okay. Okay. All right. Well, thank you, Commissioner, and I appreciate your answers. And thank you, Madam Chair. That's all my questions.
Thank you.
Thank you. Thank you, sir. Thank you. Representative Datham.
Thank you very much, Madam Chair, and lovely to see you, Secretary McCaw, and I'm glad you're feeling a bit better. COVID was really rough. I was a year ago. So first of all, I just wanted to say I'm really pleased to see the focus in on Project Longevity. It is such an important program, and I'm really glad to see that the governor is supporting this. This is really important. Really just wanted to ask my main question on the oversight. And we heard yesterday from the Contracting Standards Board, and I'm a little disappointed that we're not focusing on that because that's something that I believe is very important. I come out of public accounting. I come out of a business background. We've done a phenomenal job as a state to focus in on the IT optimization and the HR centralization efforts and really kind of focusing on there. I see that the Contracting Standards Board is a really forward-looking opportunity as the state to become much more strategic and long-term and focused, where our auditing function really looks kind of in the rearview mirror, so to speak, to see that we've done everything appropriately like we're saying we're doing. I'd really like to hear how we are tackling oversight, because I do think that this is super important and we need to make sure that we're doing everything, we're spending taxpayer dollars wisely and efficiently. So if you could please address that, I'd appreciate it.
Most definitely. Representative Dathan, I couldn't agree with you more. Now more than ever, we want to ensure that, the Office of Policy Management, certainly DAS, the state of Connecticut, the executive branch and all are fully adhering to expectations surrounding contracting and ensuring public trust. Let me clarify a couple of things because I did have a chance to see some of the footage from yesterday, and I want it to be very clear on the record what the governor's budget does with respect to the Contract Standards Board. It does not modify any of their statutory role or any authorizations that they currently have in law. We've been having some conversations over multiple years about needing to staff up the Contract Standards Board. One of the concerns in our work with the Contract Standards Board that we recognized is that their board members are conducting their audits. And in statute, there is an audit function in the Contract Standards Board, and board members are fulfilling that role. We believe that it's important that staffing be provided for that audit purpose. The governor's proposal as a starting point for our discussions this year was to give the Contract Standards Board the ability to task the state auditors of public accounts to perform those audits. We do propose 3 additional positions and at $220,000 to support that functionality. So obviously there are other discussions to be had about the Contract Standards Board. For example, the statute has a role for them for training. OPM and DAS do training. They also have a role for certifying and vetting procurement professionals. And we need to sit down and have those discussions about what pieces are currently being handled, what pieces do we need to staff the CSB for. But it was critically clear to the administration that the auditing function is paramount. And we thought we would leverage the expertise of the auditors of public accounts, giving the Contract Standards Board the ability. The bill doesn't say shall, the bill says they may. They may utilize the auditors of public accounts to perform those audits, to identify findings, corrective action measures, breakdown of internal controls or deficiencies that would then go back to the Contract Standards Board, and they would take the actions as they see fit based on their current statutory role, which remains untouched. So I do recommend, LCO staff obviously help draft, that they provide any clarity, but absolutely not, as Governor Lamont, changing any of the authorities of the Contract Standards Board. We're actually trying to give some positions here to support their audit functionality.
Again, I thank you for that explanation. Again, my concern really isn't that the auditors aren't doing their job, because I know that they're doing their job and they're looking in historical. I want to make sure that the state of Connecticut is efficient, running really well on a prospective basis. And I do think procurement is a really important way that we can make sure that we, consolidate that function, but also really looking forward and thinking more strategically and long term. I think traditionally government organizations are very sort of fixed in the short term 2-year budget cycles, and I don't work that way. I'm a strategic person. I like to be thinking long term and strategic. And I'm concerned, and I'm just raising the flag, and I want to carry on these conversations, that I think focusing too much in the audit is not going to be strategic in nature. So I will stop talking, because I know this is a hot topic, but it is important to me. And thank you, Secretary McCaw, for your explanations. And thank you, Representative Walker, for indulging me here.
Thank you, Representative Dathan, and we look forward to those continued discussions throughout the session to strengthen the roadmap for Connecticut and our work with surrounding procurement and ensuring that contracting
Thank you.
is being handled.
Thank you, Representative Dathan. And Secretary McCaw, I think Representative Dathan has been speaking on behalf of a lot of legislators, because we don't feel that there is too many oversights, because something could slip through the cracks. So, and the whole idea of maintaining the independence is really critical, because when you pay me, then that controls what I say. And that is really the issue that we are looking at here. It's making sure that the voices are not muffled because of the fact that they are under either the administration or even the legislature, but they have an independence on both sides. And I think that we should welcome, because sometimes we make mistakes. And so I think it's just us keep going and looking at that issue. So I know our leadership is looking at that, and they're saying for us to stay focused on that also. So I appreciate all that we can do to make sure that everybody stays independent and gives us that information. So are there any more questions? Are there any more questions? Wow. Secretary, you got off really easy.
Oh, I'll be happy to come back.
Oh, we will be very glad to bring you back. And so I think that's going to be good. We're going to have some robust conversation, I'm sure, on a lot of the issues. Oh, one quick question. I forgot one. In the ARPA plan, you brought back the 155 that we allocated last year for UI. So I'm confused. So are we double counting this 155? Because we paid for it last year in the budget. So I'm trying to figure out how does it get back over here?
I think no, we did not allocate any additional dollars to UI. That might be confusing, 155 million for testing. And you'll see in the ARPA plan, there's a recommendation for us to build in a $270 million allocation towards testing over the next 2.5 years. The state found ourselves in a jam in January, February with the Omicron variant, where we needed $50 million and we did not have any reserve. So I won't belabor the time for you today. Happy to talk about it in more detail. We broke that out in 2 years.
In detail, I'd like to know exactly who are we talking about in this issue of the 155 million. We'd like to know who the contractors are and what the whole establishment is and how that money is going to be spent, because that's a large amount of money and we have a lot of other issues that are also needed. So we'd like to know a lot more detail on that. So I look forward to getting that information in the budget. And
very good.
You're absolutely right. It's the same number. It is the same number.
Yes. Yes.
Thank you. Thank you very much. Thank you,
have a great day.
everybody. And I think that concludes our hearing on General Government B. And I believe, Madam Administrator, what are our marching orders?
So we were back at 1 o'clock with transportation from 1 to 2:30 and regulation and protection from 3 to 4. It is, just to remind members, it is one link for both subcommittee presentations. I did that in the event that should transportation run over, we didn't have to worry about switching up. So.
Okay, great.
Okay.
Thank you. And I also want to thank all the members that pitched in last night. You guys were amazing. And I really appreciate the ability to get a little sleep periodically. So thank you so much for that, especially on my birthday. So I want to thank everybody personally for that. That really made me feel, special and good. I have to say I did not watch, but I didn't think you expected me to. So it's been good. Talk to everybody at 1 o'clock. Thank you. Bye-bye.
Thank you, Representative.
Bye-bye.